An estimated 1 in 6 people in New Wessex and San Patricio counties have diabetes.
We have a lot of people in this area that live with that gene, and then we have so many uninsured people here also, and that's one of the problems, and those are the people that often fall through the cracks in the medical system and don't really get the care they need. And sometimes it's something as simple as navigating the system or knowing where to go to get help.
According to the Centers for Disease Control, educational programs on diabetes prevents hospitalizations. Every $1 invested in such training can cut healthcare costs by up to $8.76. Despite the high numbers of diabetics in the community, Corpus Christi only has 3 diabetic educational programs. One of those programs is the food bank's diabetes hands-on classes, where diabetics learn how to take their medications, how to eat right, and how to manage their blood sugar. The program consists of 8 classes, and each class starts off with a hands-on activity, where participants serve themselves dinner and learn how to measure out their portions properly and balance their nutrients.
It's very helpful because they teach you from the beginning to the end how to read labels, how to measure your food, what's a starch, what's a carb. I mean, it's like with me, it was really overwhelming because I didn't know where to start.
Often I meet people that don't even know where their blood glucose levels should be. And so education is really key.
Key in helping diabetics take control of their blood sugar, and the program has the numbers to prove it. Over the last 4 years, the average post-A1C levels of people who take the class have been lower.
The doctor's office, they just basically tell you, okay, yes, you're diabetic, you need to cut your sugars, watch your carbs, and then that's it. A lot of the doctors have 15 minutes per patient, where here, it is, I believe it's like an 8-week course, so they take their time with you.
Corpus Christi's 2 major hospital systems, Corpus Christi Medical Center and Christa Spahn Hospitals, have closed their diabetic programs over the last 10 years.
I mean, it doesn't really help the hospitals to help people stay out of the hospital, and that's just a cold hard fact.
Spahn Hospital said they still provide classes in Alice, Beeville, and Kingsville, but had to close the programs in the city due to poor attendance.
No one really wants to pay for it when you think about it.
And Bradshaw is not sure who is going to continue to fund the food bank's classes.
Right now we exist through a grant. And so what happens when our grants run out? What happens to the people?
For Caller.com, I'm Sarah Costa reporting.